Hello and welcome to Medicine with Dr. Moran. I'm Dr. Keith Moran. In this video, I want to talk about COVID-19 vaccines. I've been getting a lot of questions about how your immune system and all the vaccines actually work. I want to briefly summarize this to make it easy for you to understand. There are timestamps as in all my videos in the description if you want to jump ahead. Now, all of us have had vaccines, but what is a vaccine? It's a substance that we use to stimulate the production of antibodies and provide immunity against a disease. The vaccine is prepared from the causative agent of the disease or its products, or it could even be a synthetic substitute, which will act as an antigen or foreign agent without inducing the disease itself. Essentially, vaccines present humans with something that allows our immune system to get primed and to make antibodies and teach our immune system to respond if we come into contact with that infection. You could think of it such as receiving the battle plans for a war ahead of time so that you can get your body ready that if you do acquire the infection, in other words, go to war, you're ready to quickly defeat whatever comes in front of you. When it comes to COVID-19, the target of the vaccinations is the spike protein on the surface of SARS-CoV-2. The reason for this is because this is the way the coronavirus attaches to human cells, as you can see on the slide. The coronavirus infects human cells and releases its RNA into the cell, which tells your cell to produce copies of the virus. More virus gets assembled, and ultimately copies of the virus are released from the infected cell. We obviously want to stop this process, so the target for all the vaccinations is the specific spike protein, not the other components of the virus itself. Now, if you don't want to have the vaccine and you get infected, this slide shows you how you would respond. As you can see, the virus gets into cells and replicates, causing inflamed tissue. Our body has dendritic cells which identify the virus as foreign and carries them and presents them to white cells called lymphocytes. These infected cells and immune cells will release cytokines, which are proteins that access signals or alarms and call for reinforcements. There are different kinds of lymphocytes, including cytotoxic or killer T cells, as well as helper T cells and B cells. These cytotoxic T cells recognize infected cells and kill them, as well as ultimately killing the virus itself. The B cells will activate an antibody-producing cell called a plasma cell to make antibodies to the spike protein, which will then bind to the virus to neutralize it. There are different kinds of lymphocytes, including cytotoxic or killer T cells, as well as helper T cells and B cells, that will recognize the virus for months or possibly even years, providing long-lasting immunity. We do know, based on patients who have had COVID-19, that immunity lasts out at least 8 to 12 months in terms of the B cell and T cell memory responses. It may be that it lasts longer, we just don't know at this point. Now, vaccine makers had to decide how the vaccine, when injected into humans, would generate an appropriate antibody and cell-mediated immunity to the spike protein. This slide from the Harvard School of Public Health shows how different vaccines can accomplish this. There are four main types of vaccines on the slide. There are the messenger RNA vaccines, with Pfizer and Moderna being examples of these. There are vaccines which utilize inactivated or weakened virus to generate immunity, such as Covaxin, which is yet to be released. There are also protein-based vaccines in development that use proteins that are very similar to the spike protein in order to generate immunity. Lastly, there are the viral vector vaccines, where we use a genetically engineered virus, typically an adenovirus that's genetically engineered to not cause infection, which carries DNA inside itself, and it instructs your body ultimately to produce the spike protein. Firstly, as I've explained in my Pfizer and Moderna videos, these two vaccines use messenger RNA technology, where the messenger RNA is encapsulated by a lipid nanoparticle, which is taken up into your cells after intramuscular injection. Then this gets released into the cytoplasm. It then travels to the ribosomes, which are cellular components in the cytoplasm, which will then transcribe the messenger RNA into the spike protein. The spike protein is then presented on the wall of the cell for the immune system to see and respond to. On this slide, one can see how the viral vector vaccines work. The Johnson & Johnson vaccine as well as the AstraZeneca vaccine both work this way. Both of the vaccines have viral DNA inside an adenovirus vector. The adenovirus is genetically engineered, as I mentioned earlier, so it does not cause infection, but it's actually taken up into your cells and then into the nucleus of the cell, where the DNA inside the adenovirus is then transcribed into messenger RNA. The messenger RNA then travels into the cytoplasm, and much like the Pfizer and Moderna vaccines, it heads to the ribosome, where it then gets translated into protein, where it makes the spike protein. So these two vaccines have additional steps. That is, the DNA has to go into the nucleus to make messenger RNA. And this is obviously a step that Pfizer and Moderna do not have to do because they deliver the messenger RNA themselves to your cell. In any event, the end result is the same, making the spike protein and having the spike protein being presented on the surface of the cell so that your immune system can see it and then respond to it, as of course it's a foreign entity. It's important to note that if you receive any of these vaccinations, you will make multiple different types of antibodies against different parts of the spike protein. You don't just make one antibody. You make multiple antibodies to different parts of that spike protein. This is why even if the spike protein changes in new variants, the vaccine can still have good efficacy. Now obviously, if there is a mutation, it does still remain to be seen through clinical testing to be sure that what people make with a vaccine still works against these new variants. Thanks a lot for joining me today on Medicine with Dr. Moran. I hope that you've enjoyed this quick tour around what happens if you get SARS-CoV-2 and how that differs from the vaccinations and how the vaccinations work. Knowledge is empowering. I'm Dr. Keith Moran. Get healthy and stay healthy.